If you've ever suffered from chronic sinus pain, you know it can be very painful, even debilitating at times. But how do you help your kids when they suffer from it?
Back with us today is Dr. Madan Kandula, an ear, nose, and throat surgeon, along with Karen BASSI, the mother of one of his patients. Thanks for being here, you guys.
Thanks for having us.
Thank you.
I think this is a really great topic, especially when we talk about, trying to figure out, as Molly was kind of talking about her kids and your kids during the break, what's wrong, get to the root of the problem. You say, doctor, that a lot of times these sinus problems are insidious. What do you mean by that?
Yeah, I mean, a lot of times, and we'll talk about this, today, is a lot of times we don't know that's the issue. And so, you can have either nasal obstruction issues or chronic sinus infection issues, and if that's all you've ever known your whole life, how do you know, that is a problem? And so that can cause problems in its own right, but a lot of times it creates problems downstream as far as, headaches and tiredness and other things that might be the primary concern, but you don't know that the root of the problem is somewhere else.
Well, I think what's sad or makes your heart ache as a parent is that these problems, sometimes you're not aware of it, you don't know what exactly is wrong with your kids, because you see secondary problems kind of like, and they can be suffering for years, and you can kind of be treating symptoms and not know that there's an underlying problem. So you have a son, 20 years old at the time he was diagnosed. What were you noticing that made you think that there was a problem?
For years I had noticed there was something wrong, and he also had asthma, and he was under control with asthma, so we were going to an asthma doctor too, who was wonderful, but he was having such a hard time waking up, more and more so as the years went on. And in January a year ago, when he was home from UWM, was really the pinnacle of it, when we were on excuse me, 94, and it was a terrible day, and cars were sliding off the road, and he just wanted to go to sleep in the middle of the day. And I said, Joseph, is this bothering you at all? And he said, I'm fine, and that he kind of felt this way all the time. So I was really, really worried at that point, called the doctor, couldn't get into his normal doctor, and they said, this can't wait. I think they were thinking mono probably is the first frontline thing you think of. So we went to see an internist, and he did a very complete family health history and so forth, and diagnosed hypersomnolence, which is excessive sleep. And as we were saying at the break, I thought, great, but there's still something more. There's an underlying problem, and that wasn't received very well. But in my heart as a mom, I knew that now we had a name for those symptoms, but there was something more. And I had been watching Dr. Kandula on the Morning Blend for a couple of years.
I didn't know that part of the story.
Oh, go on. Yes.
Really? Go on and on. Yeah.
Oh, go on. Truly. And I watched him, and his approach was innovative and quite different from all the other ENTs and primary cares and everybody that we had seen in the past. So I think it was probably August that I called, and we got in, and I knew at his examination this was going to turn out. I was prayerful and hopeful that it was going to turn out differently, and boy, did it ever.
What was wrong then? So he had this excessive sleepiness, he had trouble waking up. What was his problem then? What did you find out?
Well, his problem is he never complains, and he's an athlete. That's his problem. But specifically what Dr. Kandula found is there were 3 problems going on, and what those were is there was a solid blockage here, and he had a severely bent septum, and I said to my husband, I know he's got a bent septum, and then the turbinates in his nose were oversized for his body. And Dr. Kandula looked at me and said, I don't know how this boy is getting any air, but doctor would do a better job at describing what he all saw in there. But
yeah, I mean, I guess,
was there a reason for him to be so sleepy?
Basically, that was the question, and in answering that question, it's really looking on all areas. And so the area that we start with is the nose. That's where you start breathing. And if you're not breathing properly through your nose, you're not going to do well, period. You're not going to sleep well, so forth and so on. And so that may not be the issue, but in his case, when I looked in there, it was definitely blocked up. And so we could see that just plain as day, and looking in there. Based off of that, we set him up to get a CAT scan done in the office, which gives us the information on the sinus front. So in addition to being blocked up breathing-wise, he was blocked up sinus-wise, and so both of those things were weighing down on him, and we decided to change that.
Why do you think it is that they could go to doctors for years and years and get pills thrown at them or more medication, and nobody gets to the root of it? Why do you think that is?
I think part of that, the CAT scan is helpful. I think the mindset is helpful. Just sort of recognizing how significant these issues can be, and sometimes they get minimized. Sometimes they say, well, you know, you've got a deviated septum, fine, deal with it. You're a little tired, deal with it, but that's not acceptable.
Yeah.
So
and how's he doing now?
Yeah.
How's Joseph
he's
doing?
doing great. I called him. I was hoping that he could be with us today, but he's in school and had classes. So I said, in your words, Joseph, how are you feeling? And he said, great. And what that means is, he said, I wake up like a normal person now. He can wake up normally, get up, get moving in his day. When he is awake, he's more alert. And he also said, I have 100% more air. And I said, 100% more air? And he said, truly. He said, I can't explain. So to parents, I want to say, if your kids are excessively sleepy, or if you've got boys especially who are in basketball and football, which is a in-your-face contact sport, and there might be something going on there, it might not just be mono, it might not just be, if antibiotics aren't doing it with a regular ENT, you're probably not at the right ENT, because in all of our experience, we always hit a brick wall. When it came to the point where they said, here's a prescription for antibiotics, that was the end of the road. It was a dead end, and I knew it was never going to be fixed. And then
it's the difference between treating symptoms too and
Correct.
treating the root cause.
Yeah.
I mean,
Absolutely.
you give somebody their life back like that, really. The quality of his
Right.
life has improved so dramatically, and I would think that'd be rewarding for you.
Absolutely. That's what I do, why I do what I do. Absolutely.
I think that is
So
fantastic.
I'm very grateful to Dr. Kandula. He was the one I could tell when he went further, and his CT scan films too were small and concise, and he could show me exactly what he was seeing and communicated to me in a way as a parent that I could easily understand, and that my son did. And it was all the difference. So I said to Joseph, trust me one more time. He was like, another doctor, and I said, trust me. I know, just trust me one more time. And so he was really glad for that. So don't give up, parents. If your children aren't feeling well, or they're excessively sleepy and you're not getting anywhere with the doctor, it could be an underlying issue with sinuses that you may not be able to tell. Call Dr. Kandula. I'm so glad. It took 10 years.
Yeah, that's a long time to
so
suffer
glad he's
too.
doing better.
Thank you.
I bet
Thank
just
you.
in general, schoolwork,
Yeah.
everything has totally
that's
changed.
huge.
Here's the information for Advent. The Sinus Center, so that you can contact them, is on North Mayfair Road in Tosa. The phone number to call is 414-771-6780, or advent.md is the website. Thanks for sharing your story, Karen, and thanks,
Thank you.
Doctor.
Nice
Thank
to
you.
have you
Thank
guys
you.
here. Thanks.